Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, formerly Lee Regional VNA, providing first-rate, highly personalized short and long-term care for thousands of people in Berkshire County and also in the hill towns of Hampden and Hampshire counties, all in the comfort of their own homes. And today we're going to be talking about the home care side of things, which people would recognize and think of as the non-clinical side of Porchlight VNA home care. However, the services are so important to so many families to keep individuals within their own home. So I'm very happy to welcome to the program Michelle Schnopp, who is the director of Porchlight Home Care, and also Mary Catherine Kern, who is the business director element of Porchlight. So the two of you, welcome to the program. It's great to have you. So the home care side of things, you know, they work together, you know, VNA and home care, and prior to the name change, it was Lee Regional VNA and Berkshire Home Care. So Michelle, can you tell me a little bit how these two sort of work together and how they complement one another?
Well, the VNA and the home care definitely work together. VNA is services that someone would get after an acute illness in a hospital or in a nursing home or maybe a fall. They would get acute services through the VNA, skilled nursing, physical therapy, occupational therapy, those kind of services that would help them recover. And then home care comes into play when maybe they have a new diagnosis of, say, congestive heart failure or a dementia, and they're going to need some ongoing care long-term to keep them at home. And that's where home care comes in. We pick up there and keep the client safe at home, in their own home, with their families, and as independent as we can. We try to maximize the quality of life that they have left. And during their stay with us, they may need to go back and may need to have VNA services again if they have an episode where they have a flare-up in their condition. We would refer them back to the VNA, and the nurses would come out, the therapists, if they had a decrease in their functioning, to try to maximize their function at home so that they can stay at home, because that's really where everybody wants to be. They want to stay at home. Nobody wants to age in a nursing home setting. They would obviously prefer to be at home. So that's our goal, to keep them home and as well as we can.
And it's kind of, it sounds like a seamless transition for people who may need the sort of clinical level services to be able to stay at home, even though they still need a little bit of help, but the need for clinical services may no longer be there. And to have it all under one roof, I mean, you certainly, I mean, literally, as far as the two offices, I mean, they share a parking lot, and the VNA side and the home care side, you're always working together.
Yes, we are always working together. A few years ago, we created our home visiting nurse practitioner program with that in mind of keeping clients at home. We know that clients that have congestive heart failure, diabetes, chronic obstructive pulmonary disease will have occasional times when they are sick and they're acutely ill. And we thought if there was a way we could keep them at home and treat them before they got to the point where they needed hospitalization, they'd be better off. Obviously, insurances would be happier if we kept them at home. So that was why we created the nurse practitioner program. So our nurse practitioner goes out and visits these clients before they get so sick that they end up in the hospital for a week. So if they have a urinary tract infection, or in the wintertime we saw a lot of clients that had respiratory infections. So she would get out there, she can diagnose and treat them in the home before they end up in the hospital. So that was our goal with that program, to keep these people at home, and it's really helped with keeping them where they want to be and keeping them out of the hospital. And we all know with Medicare reform and with healthcare reform that clients can't be staying in the hospital as long as they were. The goal at the hospital is get them out as quick as we can, get them home, and so we need to try to keep them home where they can be healthy. So our nurse practitioner referrals come from all over the place. They can come from clients that we already service, or we've had calls from physicians' practices who can't see a client or have a client that's at home and it's in the wintertime and they have a difficult time getting into the office. And we send her out and she sees them, and the results have been great.
And Mary Catherine, one thing that Porchlight does, and very proud of it, is a program to educate younger people, well, sometimes younger people, not always younger people, but people also who want to switch careers, because becoming a certified nursing assistant is one of the major ways people step into the healthcare world as far as employment opportunities. So one of the things that Porchlight does is have a CNA program that we've talked about in the past on this program, but you are a big coordinator of that, interviewing potential students and that sort of thing. So tell me about how that program was set up and its goals for the community.
Well, I think its goal would be certainly to get as many qualified, caring people out there as we can to take care of individuals in their own home. The people that came to me, this is my actual first experience directly with the students, and you made a good point. There's quite a range in the CNA program in ages. I had people come in very young. We've had a few even high school to someone in their late 40s. But the best thing is they all want to help. They want to get into something that they can get out there and they can really help people. Their enthusiasm, it's been a very positive experience. I didn't meet anyone before they even had entered the class who wasn't so enthusiastic, and they were so happy to be part of it. So I think that it's really going to help to get people out there, whether they work for us or really whether they don't, who really care. They care about doing good work. They care about helping someone. I would say more than half of them talked on and on about being able to bring someone to where they need to be and to be part of it and help them. And even if they're not a nurse, they can still go in this capacity. And also, many of them are looking forward to moving up from CNA. So it's really a stepping stone, and in the meantime, helpful.
Yeah. It is, and I think what you hit on, Mary Catherine, was very important. It takes a special kind of person to get involved, and especially to work for Porchlight, because let's face it, there are higher standards for some organizations, and I would suggest, and based on reputation, and also based on great statistics, especially as far as some of the particulars, as far as hospital readmissions and so forth, that Porchlight is far ahead of their peers in a lot of these areas, and that doesn't happen by accident, Michelle, because you have very good people.
That was the thought behind forming the CNA program. I'm not sure you're aware, but to have a private proprietary school in the state of Massachusetts is a lot of work. But our thought was if we could educate these people, obviously they could work for us, because that's our biggest challenge, is not having enough qualified caregivers. So we just had a graduating class today, and there was 8 students in the class. We like to run the class between 8 and 10 students. We run it at Kindred Care of Great Barrington. They graciously allow us to use their facility, and in turn, we educate some of their employees as well. But it's been a great partnership with them. And the 8 students that graduated today, we're hoping that they'll all work for us. And if they don't, we know at least when they go out into the workforce, if they're at a nursing home or at a hospital, that they've had the best training that we could possibly give them. They'll take the certified nursing assistant training test through the state of Massachusetts in the next couple of weeks, and hopefully everyone will pass. They all had great grades going through the class. We have a great instructor, Beth Fasella, who teaches not only at the CNA level, she teaches at the LPN level and the RN bachelor's program at UMass, so she's certainly more than qualified. But it was a great experience. We went to the graduation, and they're all proud of themselves. They should be. And we look forward to having them work for us, actually. Part of having CNAs and having the training program was also because Porchlight Home Care is accredited through the Home Care Alliance of Massachusetts, and with that accreditation we have to maintain standards for hiring and for our caregivers, and so we do know that we have excellent caregivers.
Now let's talk about what home care is, because we've people have an idea, well, visiting nurses, they perhaps are registered nurses, but it also includes therapists and that sort of thing. On the home care side of things, I think we've spoken about how it isn't the sort of same level of clinical care, but people may not recognize or realize the range of services that are actually provided by someone who represents Porchlight Home Care. So let's talk about that a little bit, because everything from light housekeeping and laundry to transportation services, I mean, it really runs the gamut, Michelle.
Yeah, we literally do everything as far as that goes. The home health aides will provide personal care. We do meal prep, we do house cleaning, laundry, take people to appointments. Sometimes we take people to weddings, to events, to family functions. We have some caregivers that live in 24/7, shift caregivers, 1 hour up to 24 hours a day, all sorts of services, and the number of hours can range, like I said, from 1 hour to 24 hours.
24/7, yeah.
Yep.
That's amazing, and I think helpful for people to understand. And the other thing is, people may be surprised that there are opportunities for funding sources that would cover those.
Right.
When there isn't a medical element necessarily attached to it, sometimes we don't realize that there may be some sort of opportunity for people to have a funding source for that.
Obviously, some people private pay for their services.
That's probably a majority of...
Actually, I would say it's not quite the majority of private pay.
Okay.
It's probably maybe 40% private pay for their services. We have some clients that get payment sources through long-term care insurance. A lot of General Electric employees in the past, they sold a lot of long-term care insurance to their employees. So we do see a lot of long-term care insurance. We also have the Veterans Administration. They sometimes will contract with us for services for some of the veterans. And also Elder Services of Berkshire County. We do work very closely with them. We have state contracts with Elder Services for homemaking, companionship, home health aides. So that is a funding source too. So if there are, people out there that think that their loved one or themselves or a friend could benefit from some services, but their income is very limited, which is typical for a lot of people, Elder Services is a great resource. You could certainly call them. They will come out, do an evaluation, and let you know if you qualify, if you don't, and also connect you with other services that you might qualify for. So there are a lot of different funding sources.
And I also believe that you have a low-income fund.
We have a low-income fund
as well
that we use. We try to use that to bridge the gap when somebody has had some, whether it's a hospitalization or they've had some services and we're waiting to get them connected with a funding source. Whether they've applied for VA benefits or applied for elder service benefits, but we know it's critical that they have these services in order to stay at home until we can finalize
and
that.
How crucial is that, especially when we've heard so much in the news of how long people have had to wait for VA benefits, just that one in particular, but we also know that other agencies are really just slow on the reimbursements for a variety of reasons, whether it's the sequester or what have you. There's so many things that get in the way of that timely payment, and to be able to continue those services without having a hiccup in it or a hiatus is so important, because we know at the beginning of that service is probably the most important time for it.
Yep. So we do use our low-income fund for that, and we do have some fundraisers throughout the year to try to raise money to refurbish.
What's your next one, Mary Catherine? We have one cooking up.
And we have we'll do a baseball game.
Oh yes, we'll do a
the
baseball
summer.
game with the Berkshire. Is the Pittsfield Suns.
Pittsfield
Excuse
Suns.
me. I was going to say Berkshire, but Pittsfield Suns.
Yeah.
Yes, we usually do a Zumbathon at some point, which was a good one. We
And we're doing the
have
bike
the
run?
motorcycle or bike run. I'm sorry, because it's not just motorcycles.
That's
Bike
right.
run.
That's right.
And the tennis tournament.
Right. which helps raise dollars. The Audie Fergal tennis class
Yes.
That's
we
huge.
talked about.
Wow.
Yeah, that is a
Big turnout.
What a tremendous
I
event.
know.
That
On so many
is.
levels.
Right.
So
Really.
yeah, and so Mary Catherine, back to the CNA program. So yes, you have 8 graduates from this class,
Yes.
but this is something that continues throughout the year. So I
Yes.
believe there's another.
There's
course.
another class coming up in the beginning of January 2014, right after the holidays. So that'll be starting up. If anyone is interested, they can give me a call at the Porchlight Home Care. And we've already heard from some already. So I think the word is getting out about our program, and I think there's a lot of excitement about the program.
We're doing more of that here today. So as far as those who are qualified for it, what should people have as far as previous education? Is there anything that they need?
They really don't need.
Right.
I mean, they need to want to do it. I had someone in this class who, in the very first moment I met her, said, I don't know if I should do this. I'm in off the street. I've never done health care, home care, anything like this, but I've always wanted to. And I think I'll really enjoy it. And she was one of the top of the class.
Right.
So, I think it's more wanting it, wanting to do it, having an interest in doing it, and having the personality and the heart that it takes to do it.
And that's why some of these fundraisers are important, because things like books, the kind of the ancillary things that go along with
Right.
the education, and the whole course is very affordable. I know that,
It is.
Yes.
but that's why these fundraisers, Michelle, are important.
It is affordable, but as you said, still, somebody has to take 3 weeks out of their life, and that may mean they don't have an income for 3 weeks while they're taking the course. So it is important, and we do like to be able to help the students out as much as we can.
Yeah, I mean, this isn't
It's a
something
real
that
break.
you go to maybe an hour,
No, for
twice
those
a week
3
or
weeks.
something.
No,
it's
this
very
is 3
intensive.
weeks. Yep, it's very strict. It's very intensive. It's a lot for a 3-week time frame. But some of the students said to us today, we're glad it was just 3 weeks, because knowing it was just 3 weeks, you could cram and kind of get everything in, knowing that in a couple weeks it would be over with.
And they come out with a lot.
They do.
I
They
learned
really do.
through this. They really come out. Some of them even change just in being confident
That's
and having
fantastic.
self-esteem. They really did. I
Right.
could see it in some of them just in contacting them and seeing them, and from the beginning to the end was a big difference.
And,
is nice to see.
and then hopefully they'll be out there caring for individuals in the community. Now, how many people, or how many, I know it ebbs and flows because, it depends on the need that's in the community, but about how many CNAs and other kinds of staff does Porchlight Home Care have at any given time, on the home care side of things?
On the home care side of things, we have about 160 on staff. We have about 145 to 150 field staff, and
Wow.
a majority
I don't think
work.
people realize that.
Yeah, I
Yeah,
mean,
and
you're
some people-
you're a major employer, especially
Yeah,
here in
we are
southern
major,
Berkshire County.
Yeah, we certainly are.
Yeah.
Some of our caregivers work for us every other weekend. Some work 40 hours a week. So it ranges, all sorts of
It really does. It's quite a
hours.
gamut.
It is.
That's amazing.
really is.
I
Some
think
people use it as a supplemental income, a second income. Some were their primary. But yeah, anybody who has the education and the training that we need them to have, we would love to have them come see us.
And of course, we have this the relatively new. It's been about a year or so. The name change.
Oh, yeah.
So people knew Lee Regional VNA, or it was first originally Lee VNA, and then it was changed to Lee Regional VNA, and now Porchlight. And on your side, it was Berkshire Home Care. It was Lee Regional VNA and Berkshire Home Care. And I think Michelle, you came to the agency when it was Berkshire Home Care. So tell me about that transition and how people have adapted to it, because it's ultimately tied to an organization that's been around for 100 years. That was Lee Regional VNA. So how are people learning it out in the community?
I think that they've taken it actually pretty well. We were always confused with our biggest competitor, obviously, Berkshire Health Systems, and were we tied to the health system? And no, we weren't. So the name change for us was good because it really gave us an identity, and we didn't always have to keep referring to, no, we weren't part of this other organization. Yes. We were part of Porchlight.
Yeah.
But I think we've had a positive response.
So too.
I mean, all our field staff loves the name.
Less
and we
and
like
less,
it.
I have to say, Porchlight Home Care. We used to be formerly Berkshire.
Right.
I'm saying it much less.
Right, and we say at the beginning of the show here, but hopefully
But
one day we
people are
won't have
coming
to do that.
Right.
Exactly.
Because the name recognition would be what it is, and I think basically at this point, hey, you have that. Sign out on Main Street in Lee.
Right.
Everyone sees it every time they drive by, so which is a good opportunity for name recognition and branding, as it were. And also, as we have a few minutes left, I think people will be interested also in your background, Michelle. I mean, and you're a registered nurse.
Yes.
So you've obviously had that education. Tell me about your career in healthcare, and actually originally what brought you into healthcare. In the beginning of your healthcare career?
Oh, I went to college to be a nurse. My grandmother was a nurse, and so it seemed like I should be a nurse. So I went to a 4-year school and I graduated. I worked in Boston for a little while, and then came back here and saw my husband, met up with him, and so moved back to this area. I started at Berkshire Medical Center working nights in the units, and then from there I went to Berkshire VNA and worked there for years doing home visits myself, and then worked as the liaison for the VNA for a long time, and then left there in 2009 and came to Berkshire Home Care at the time, and I was going to do liaison work and marketing for them, and I did a little bit of that, and then stepped in as the interim director, and here I am.
And there you are.
And
liaisons, by the way, are some of the most important people within the system. As Michelle says, liaisons. It's sort of that bridge between. But you are great communicators in the sense that people who are in the hospital and they need someplace to go to get home, or individuals who are in the long-term care setting, and in our case coming home, you need that coordination and that ability to be able to comfort families and make sure that they know what's happening with their loved one.
And in home care, there's so many resources out there, and it takes a long time to learn what's available for residents of the community and what services that they can tap into.
It's so confusing.
It's confusing. It's very. It's confusing
Sure.
for a family member of mine. If they go into the hospital and then they come out, and they're not sure what they need. You do need to know someone almost that has some medical background that can kind of direct you, because you could just go from the hospital to home and not know that you qualify for home care services that could make that transition so much better for you. So there is a lot out there, and to find the resource for you, certainly Elder Services is a great place to start if people aren't sure, because they can certainly guide people. You can always call Porchlight VNA or Porchlight Home Care, and would certainly be more than happy to help people tap into what they can get from the services that are out there.
And certainly Catherine may pick up the phone and say, yes, Porchlight, formerly Berkshire Home Care, but indeed. So, with that, you're relatively new to healthcare, Mary Catherine. Tell me about your background a little bit, and what led you to Porchlight.
My background is mostly in journalism. I really only came into this field before I came to Porchlight Home Care. After 20 years in journalism, I went and worked in Alzheimer's clinical trials. And that was coming to an end, so I was looking for different employment. And it came to my attention that they were looking, and I applied, and Michelle was kind enough to give me a chance, because I really didn't come with specific, applicable background, but I do enjoy it.
But I think that's a good thing, and the reason why I like that, and people coming from outside of healthcare into healthcare, is because sometimes we get caught up in our clinical jargon-filled world, and we forget. And so it's important to make sure that we have that link to those individuals who have no idea what happens in the healthcare setting, so that we know how to communicate that way. I come by it honestly because I think Mary Catherine, my background is very similar. I came from journalism ultimately to, in part, healthcare, and having that ability to maybe learn healthcare a little bit, but also communicate to the outside world. It is so important because that's what you're dealing with.
Yes, it's a constant, really. I thought it would not, my background would not apply, but it does indeed. Every day, really.
Yep. Good communications is an important thing in any business, but I think healthcare more than ever. So, as we have about a minute left, Michelle, what did we miss? Did we miss anything?
Sure, we did miss a few things, obviously. But one of the important things that I would like people to know is that we do have a nurse on call 24/7 for all of our clients that we service. So if anybody were receiving services and needed the nurse, they could certainly get in touch with us. But they can always call us, and even if they aren't interested in Porchlight home care services, if they were looking for something else in the medical field for a loved one or for themselves, we'd be happy to help them for sure. So they can always give us a call.
Indeed, and your number over there is
413-243-1122.
Slightly different than the VNA number, but of
Yes.
course, if you did call the VNA,
they still find us.
They'd still find us. Either number will get to us.
And vice versa.
Fantastic.
Yeah,
so, Mary Catherine Kern, it's a great pleasure to
Thanks for
meet
having
you
me.
and have you on the program. And the director of Porchlight Home Care, Michelle Schnopp, it's great to see you again.
Thank you, John.
And thanks for coming on the show, and we'll definitely have to bring you back very soon because you have events, you have courses,
a lot of
Absolutely.
all kinds of things. So the two of you, thank you so much. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.